Are there specific tests for detecting joint inflammation? Have you ever wondered how doctors find out if there is inflammation in your joints? Joint inflammation is a common issue, especially in various types of arthritis, including osteoarthritis. The way doctors detect and diagnose this inflammation depends on what is causing it. Let's dive into the tests available and what they reveal about joint health. First, let's understand what joint inflammation is. It is the body's natural response to injury or disease. This response can lead to pain, swelling, warmth, and redness in the affected joint. In osteoarthritis, for instance, inflammation is often a result of cartilage breakdown and changes in the bone and surrounding tissues. Unlike autoimmune arthritis, osteoarthritis is mainly due to wear and tear, not caused by widespread inflammation in the body. When someone experiences joint pain or swelling, healthcare providers typically use a mix of methods to determine the cause. The first step is a thorough physical examination. The doctor will check for signs of swelling, tenderness, warmth, and limited movement in the joints. They will also ask about your symptoms, any past injuries, and how the pain impacts your daily activities. Next, imaging tests come into play. X-rays are the most common imaging tool used for osteoarthritis. They can reveal joint space narrowing, bone spurs, and other structural changes associated with the condition. However, X-rays do not show inflammation in the soft tissues. Other imaging methods like magnetic resonance imaging or ultrasound can detect inflammation in the joint lining and surrounding tissues. These tests are usually reserved for cases where inflammatory arthritis, such as rheumatoid arthritis, is suspected. Blood tests are another tool in the diagnostic process. However, they are not typically used to diagnose osteoarthritis since there are no specific blood markers for it. Instead, blood tests are more helpful for ruling out other types of arthritis that have identifiable inflammatory markers. In some cases, a doctor may perform a joint fluid analysis. This involves removing a small amount of fluid from the swollen joint to check for signs of infection or crystals, which can indicate conditions like gout. This test is not routine for osteoarthritis but may be necessary if there is sudden, severe swelling or if another cause is suspected. For most people with osteoarthritis, the diagnosis is based on symptoms, physical examination, and X-ray findings. There isn't a single test that directly measures joint inflammation in osteoarthritis because the inflammation is usually mild and localized. The focus is on managing symptoms and maintaining joint function rather than specifically targeting inflammation. It's also important to note that osteoarthritis and rheumatoid arthritis can sometimes occur together, complicating the diagnosis. In such cases, additional tests may be required to clarify the diagnosis and guide treatment. To sum it up, while there are tests that can detect joint inflammation, their use depends on the suspected condition. For osteoarthritis, the emphasis is on clinical evaluation and imaging to assess joint damage rather than on tests specifically for inflammation. Always consult a healthcare professional for an accurate diagnosis and personalized treatment plan. Self-diagnosis based on symptoms or online information is not recommended, as many joint conditions can have similar symptoms but requiring different treatments.